just to be in different places and multiple people are seeing it.
We would like the whole rainbow.
Well, I saw one complete rainbow and other people saw a double rainbow.
Nice.
Be in different places and multiple people are seeing it. Oh, you can hear me.
Like
there you go.
Whole rainbow.
I saw one. Are you testing it, Jihad? Double rainbow.
Nice.
I guess he's testing us.
Oh, you can hear me.
Yeah, he's playing there, so you're making that everything people can hear us very well.
And it looks like I should be able to click share screen. Do you want me to test it?
I am, yes, please.
Okay.
So I'm gonna also make you, Ruby as a co-host.
So you should be able to see the slide that says health coverage and more.
And once we stop sharing, what do we click to give it to the next person?
It looks like there's a red button that says stop share. And then you should be able to click share screen when it's your turn.
Okay.
So Ruby and Benjamin, you're both from the Oregon Health Authority. So when I do the introduction, I can say that, or
Benjamin's from the marketplace.
So Benjamin's from the marketplace.
Yeah.
And Ruby from the Oregon Health Authority.
Yep, you have it.
Okay. So do you want to unshare, Ruby?
Yes, I just clicked unshare, or yeah.
Okay. So we have 7 more minutes, guys. Anything that you want to talk about?
Broadcast. Are you testing it, John?
Yes, I am.
I'll be right back. I'm gonna check my connection.
That question was from earlier.
Peter to die.
So when you guys are saying, am I testing, what do you see?
We don't see anything. I just see something that's in the corner live on YouTube.
Want me to test it?
And then we can hear them.
I think you're listening to a recording, Jihad, when we asked about the testing.
Okay, because I'm trying to do a posting to YouTube.
Do you think it's better just to wait until it's all complete to see the slide that says health coverage and more?
Yeah. So if I,
and once we stop sharing,
you know what, I'm not gonna do it. I'm gonna
give it to the next person.
I'm gonna stop the.
Like there's a red button. Yeah, I think it was repeating everything we've already talked about, right?
Yes.
Stop share.
Okay. Can you hear me, guys?
Yeah.
Okay, so I'm gonna stop the YouTube, and I'm gonna just take the recording and then later on put it on YouTube.
Okay.
And the same thing for what do you call it, for Facebook.
Okay.
So we'll just put it there after we're done. After we edit, if there's any editing that needs to be done and things like that, then we can do the YouTube and the Facebook.
Fantastic. I'm gonna open my window because it is hot.
And here's his cold.
Yeah, I'm cold. I'm like wish I had worn something under the sweater.
Are you in the office, Benjamin, or are you at home?
No, I'm at home.
Well,
my office is in Salem,
you didn't pay your bill today, man?
It's just like our heating system is just really old, so it's like not very efficient. So it'll be on forever until it really heats up. So we keep it going on in like the living room, but the bedroom is like, just wear blankets, you're on your own. It's a free for all.
So if we're not presenting, sometimes what we do in different presentations, I guess I should ask what the expectation is. But if we're not presenting, we usually turn off our camera so that the camera is mostly on the presenter. Do we just leave them on, or do you want to leave them off if we're not presenting?
It is up to you guys. I have done it in both ways. So I can either, you turn off you mute yourself and mute your camera. And then, when you're talking, you bring yourself back to life. So
That's a really good point to mute if we're not talking, because
Yes.
you can pick up on the background sounds.
Yes.
So is there a waiting room for this meeting? Can you actually see how many people are waiting?
I don't know if I have done it that way, to tell you the truth. Let me see here.
Or do people just log in?
I think they will log in. I'm gonna start it in a minute. It is 3:57 now. I'm gonna start it actually now, so that people are able to see, hey, we are here. Is that cool, guys? Should I start it now?
Sounds good.
Yeah, that's okay.
Okay, there it is. It is broadcasting. So we have 8 people now. So hello and good afternoon to everybody who's joining us. My name is Jahed Sukhan. I am with the Muslim Educational Trust, and I am the Chief Operating Officer here at MET. MET is a beautiful organization that has established in 1993, and we are in Tigard, Oregon, on Shoals Ferry. Today's webinar, and here we're going to talk about health coverage, and and what are the requirements for health coverage, etc. Due to the COVID, as you know, we have a lot of people who lost their health coverage due to COVID, due to loss of insurance, due to loss of employment. So today we are partnering, MET is partnering with Virginia Garcia, with the Oregon Health Authority and the Marketplace, for them to talk about to you about health coverage, how you can get it, the different forms that's available online, and and hopefully they will make the process really, really, really easy. Online here we have Anna Prego from Virginia Garcia, Ignoli Dyke from also from Virginia Garcia, Ruby Graven from the Oregon Health Authority, and Mr. Benjamin Becerra from the Marketplace. We're gonna have Ruby starts the discussion first, and she's gonna talk to us, and then we will go from there. If you have any questions, please use your question and answer button in your phone and in your computer, or you can chat with us online, and we will monitor that chat. We will monitor that question and answers, and we're going to try our best to answer your questions live. And later on, we will have a survey that hopefully we'll send it to you. We have your email addresses that we can email you. You let us know your feedback if you want other coverage, other information from the panelists in here, and then we will go from there. So now, Ruby Graven, and she is the queen of the hour now. Thank you.
Thank you, everyone, for joining us on this fine day. I'm Ruby Graven with the Oregon Health Authority and a regional outreach coordinator. So what I do is I support community partners like Virginia Garcia Memorial Health Center to assist Oregonians with enrolling in health coverage at no cost. I appreciate the time you've taken today to be here with us, and I will get us started. So just bear with me while I pull up our presentation here. Just a second. And you should be able to see my slides here shortly. Jad, do you want to just confirm that you can see my slides okay? Perfect, thank you. All right, so for those of you who reserved time today to learn about health coverage and more, so that you can get the word out in your communities, with your family, your friends and neighbors, again, I appreciate your time. So what I will be talking about is just the basics of the Oregon Health Plan, also known as OHP. What it is, what is covered, who qualifies, how to apply. And I'm also going to touch on local community supports. So we do need some assistance. We need help getting the word out about local community support. So I will be covering a little bit of that. And at the end, there will be time for questions. OHP, what it is. Okay, so essentially the Oregon Health Plan is free health care or health coverage for people who meet income criteria and other requirements. OHP covers medical care, dental care, and mental health care. And as of the last 2 years or so, now more children and teens can get OHP regardless of immigration status. You're probably wondering what is covered. Essentially, people will have coverage to their checkups and immunizations, dental care, hospital stays, medications. If you know people who need physical therapy after surgery, physical therapy is covered. Mental health services, such as counseling. So there are people in our community who are needing that extra support. And the good news is that mental health services are covered. Help with addiction to alcohol and drugs or cigarettes. I know, a lot of families have family members or friends that suffer from different illnesses. So it's very important we explain what all the benefits are. Rides to healthcare and appointments, urgent care, COVID testing and treatment, and vision care for children through age 21 and pregnant women. And then for those of you who are curious about interpreter services, anyone enrolled in the Oregon Health Plan should be able to access a medical interpreter within their provider. And then under the Oregon Health Plan, we also have a benefit package called CALM, which is Emergency Services. So this is where adults who do not meet immigration status requirements can at least get emergency coverage called CALM through the state of Oregon. It covers, as I said, emergency services. So if somebody needs to go to the hospital, perhaps their appendix ruptured, or they need an emergency surgery, an emergency treatment, and maybe they need to be transported by ambulance, this would be covered. So who qualifies? In order to qualify, people...
Ruby, can I interrupt a little bit? Would you like questions as you're talking, or would you like questions at the end?
Well, if somebody has a question before I move forward, I'm happy to answer that now. That's okay.
Okay, we have a question here. Is braces covered in this coverage?
That's a really good question. I would have to circle back on that. I think it could depend on the scenario. That is definitely something I can look into and circle back on after the presentation.
And I'm hoping that, if we have some circling back and things like that, we will send these answers in the survey when because we do have your emails, we will send an email to everybody with some of these answers. Thank you.
Yes, and I can also, make note of that and circle back as I mentioned. So if you see me taking notes, it's really just because I need to look into it and get back to you.
Thank you.
Other questions so far?
No, that's it.
Okay. So you're probably wondering who qualifies, and here are basically the most important points we're going to look at. We want to make sure people live in Oregon. We may say you need to be a resident of Oregon. That just means you live in Oregon or intend to live in Oregon. So if today is your first day living in Oregon and you intend to stay here, you are considered a resident of Oregon and you could potentially qualify for OHP. We're also going to look at income criteria, and we do have specific income limits that people need to fall under in order to be eligible for OHP. And we're going to look at age to see which benefit package you're eligible for. And we will ask people if they have access to other types of health coverage and whether they are disabled. So these questions are mostly to figure out what benefit package people qualify for. The questions are not to screen people out, but really they're meant to screen people in and ensure we enroll them in the appropriate benefit package. So we are going to ask for help. Please do get the word out. Many people qualify for OHP and they don't know it. The best thing people can do is just fill out the application with a certified, trusted local community partner in order to know if they're eligible. Many times we might share some of the eligibility criteria. We might talk about the income criteria, but we don't want people to screen themselves out trying to figure out on their own if they're eligible. It's best just to complete the entire application with a trusted community partner so that you can get that accurate eligibility determination. So how to apply? Well, applying for the Oregon Health Plan is of no cost to you, and you can work with our local trusted community partners right here on the screen in front of you. Very soon, Virginia Garcia Memorial Health Center will be speaking right after me, so you'll get to hear from them. This is one of our local trusted community partners who can help you apply at no cost. We also partner with the Centro Cultural, Asian Health and Service Center, Lutheran Community Services, Project Access Now. We have community partners that speak different languages and are, bilingual, bicultural. If you want a community partner who speaks a specific language, I would encourage you to visit OregonHealthcare.gov and click Find Local Help.
Ruby, I have another question.
Okay.
The question is there a copay for, I'm not sure how that is, it's CAWEM.
There are no co-payments with the Oregon Health Plan. If people qualify for the Oregon Health Plan, it will be of no cost.
Thank you.
Yes, and in today's presentation, Benjamin from the Marketplace will talk to you about what to do if you don't qualify for the Oregon Health Plan. So there's always going to be, you know, other options you want to look into, and we'll be sure to talk about that today. So there are free community resources, and for that reason, I wanted to be sure to talk about that, because a lot of times we talk about health coverage or health insurance, but it isn't really what makes somebody healthy. Making sure people are healthy and well requires all sorts of services and access to someone's highest potential, all under one roof. And one way we ensure people are healthy and well in their community is to connect them to free resources or community support. So we've built a website. It's called safestrongoregon.org. And if you visit that website and you click at the top right, you can actually translate the website in different pages. And you can find things like rental assistance, utilities, and food, or learn more about COVID testing. And I can actually change slides if you just bear with me and pull that up here. Are you able to see the new website here in front of you?
SafeStrongOregon.org. Yes.
Mm-hmm. Perfect. So this is what Safe Strong looks like. Again, notice the website address at the top, safestrongOregon.org. You can translate this website in various languages. We have it in English, in Spanish, Arabic, Russian, all sorts of languages. Just go to the top right where you see the translate button. And if you're looking for community support, so I'm clicking on community support, you'll notice that you can find services, for example, for rent assistance. So under housing, you can learn more about protections for renters. So for example, right now we have an eviction ban in Oregon. If you know somebody who needs rent assistance, you can click on Community Action Agency, and this will take you to a list of...
If you are going from one website to another, I'm only seeing just your free community resource, Make Communities Healthy.
Okay, so are you looking at the PowerPoint?
Yes,
Sure.
I'm looking at the PowerPoint.
Okay, well, we can definitely follow up and do something separate on navigating this website, but I just want you to know that it is available. So you can, on your own time, just go to the website and kind of play around with it, and know that those resources are available. And the reason we're talking about them is because, you know, public health, housing is very much related to our health and well-being. All right, so that is the last note I have. And, you know, Benjamin is going to be talking more about the Marketplace. Anna will be talking about Virginia Garcia. There's definitely additional resources within those agencies. So thank you for sticking around today.
So as you guys can see from Ruby's presentation, there is a ton of resources that the state of Oregon has that's available for a lot of people. You know, you should, if you are in need of health assistance, housing, you know, utilities, all these kind of things, and you're affected by COVID, please, 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 you know, contact and go to this website. And I mean, you know, it is available. We have been helping people with the rental assistance through different areas, different means. You know, doesn't matter where you live, whether in Washington County, you know, doesn't matter which city you live in within Washington County. And for the health benefits, it doesn't matter which part of the state you're living in. So, you know, don't feel, oh, well, I don't know where to go, or what to do, etc. Please, you know, it's a matter of just visiting that URL and see what's available for you to click on. And believe me, you'll be amazed in the amount of resources that's available for a lot of people. And also, it's something that you have paid for through your taxes. So, you know, you should be able to enjoy the taxes that you paid. And it is, you know, your taxes are for the rainy day, and this is a rainy day. So next we have Anna Abrego. She's going to talk to us about Virginia Garcia. And Anna, the floor is yours.
Thank you. Hi, good afternoon, everyone. I'm Anna Abrego, the Eligibility Specialist Supervisor at Virginia Garcia. And with me, I have Ignolia Daika as well. Here, let me share my screen. Let me know if you guys can see it. Are you guys able to? Just one moment here. Are you guys able to see the slides?
Yeah, I see our mission and a little girl.
Okay.
Virginia.
Perfect. Yes. Perfect. Perfect. Would you like me to start, Ignolia? Okay, perfect. So our mission, Virginia Garcia is a catalyst for change in health coverage. The mission of Virginia Garcia Memorial Health Center is to provide high quality, comprehensive, and culturally appropriate primary health care to the communities of Washington and Yamhill counties, with a special emphasis on migrant and seasonal farm workers and others with barriers to receiving health care. You can see here, this is the history of Virginia Garcia. We started in 1975 in a 3-car garage in Cornelius, with the last being Beaverton Wellness Center in 2018. You can see that we have grown and evolved through the years. We have grown into 5 primary care clinics, 6 dental clinics, 5 school-based health centers. These are clinics that are located at the high school campuses for children under the age of 19, if I'm not mistaken, and 1 women's clinic. Who do we serve? Our patients are amazing. If we asked, if we had 100 of them standing in front of us here today, they would say, they would look like 48 would be kids, 18 years old or younger. 98 of those, 100 would live in low income households. 24 would be uninsured. 63 would be insured by Oregon Health Plan or Medicaid. Over half would be best served in language other than English, and 20 would be farm workers. These are the services that Virginia Garcia provides. Go ahead, Ignolia.
Yes, yeah. Good afternoon. I'm Ignolia Dyke. I'm the community outreach for Virginia Garcia Memorial Health Center. I'm so glad to be doing this presentation today. So the services that we offer start with little children. So we do immunizations by all means. We provide OB and gynecologist care and prenatal care at our women's clinic. Chronic disease management. So we have program for diabetes there, as well as any chronic disease, the people who have any chronic disease problem or illness. We do baby well child visits, dental care, vision care, and the vision care is in partnership with Pacific University. Behavioral and mental health care are in partnership with LifeWork Northwest. We have our own pharmacy. So each one of the sites, the primary care sites have our own pharmacy. We have health and wellness education. So we have 2 wellness center. One is in Cornelius, the other one is in Beaverton. And then during the summer, we visit the migrant farm workers, and this is just during the summer. But also, I'm not listed here on the slide, but we also currently we are doing COVID-19 testing for the community. Those are free. We do events, but also we provide the test or the screening at our sites. We currently are providing flu vaccinations for our clients as well for the communities. Thank you.
As you can, who can help at Regina Garcia enrolled at OHP? If you see here, we have 7 assisters in total that help enroll into OHP. You can see the location and their contact information for each clinic. Each is bilingual in English and Spanish. To schedule an appointment, you can call Regina Garcia's call center, or you can call them directly. It usually takes 30 to an hour to fill and submit an OHP application. Regina Garcia also provides interpretation services for those who need it. And then on a side note, Regina Garcia is accepting new patients as long as they don't have insurance and insurance that we're not credentialed with. And this is the end of our slide. I want to thank again, everyone. Thank you for letting me do this short presentation and for having us here. And again, I always wanted to thank Jahed and Ruby and Benjamin as well for doing this and partnering with us. So thank you. And these are the places or ways that you can follow Regina Garcia.
So Anna, a question for you, and this is from me actually. So if I do not have any coverage and I am sick that day, can I just walk into Regina Garcia and see a doctor, or what are my options?
So Regina Garcia is not an urgent care. So you do have to call and schedule an appointment. So if you're not a patient, you can schedule an appointment to get established. We usually advise if someone's feeling very ill to either go to an urgent care or go to the emergency room. Other than that, yeah, you would have to call and schedule an appointment.
Okay, thank you. And by the way, you know, I was a recipient of Regina Garcia when I was between jobs, and they are wonderful people when I was seeing my doctors. And now they have a beautiful place in Cedar Hills. I used to go to the old place next to Winco. So, you know, I'm yet to go and see the new place, and I'm looking forward to do that.
Yeah, definitely. It's beautiful. The building has, like Ignolia mentioned, it has pharmacy and dental and mental health all inside the building. So it's fun. It's much bigger than the old one.
Yes, that I agree with you. The man of the hour, Mr. Benjamin, he is going to start with us and about the marketplace. And it's all yours, Benjamin.
Great. Thank you so much, Jahed, and thank you for our other presenters for being here today. And thank you everyone for watching. Here, let me get my, I am here working, I'm with the Health Insurance Marketplace. So this is an option for coverage for people that don't qualify for the Oregon Health Plan with the full benefits, or maybe if they aren't offered insurance through their work. So this is kind of another option for folks that may not have other options available to them. So just overall, what is the marketplace? So with the marketplace, it's essentially a place where you can compare and shop for individual health plans. And so that is always dependent on where you live. Will change how many plans are available to you. But for example, in the Tri-County area, so Washington County, Multnomah, and Clackamas, there are 68 plans currently available. So there may be a lot of options to you. And in every county in Oregon, there are at least 9. So you may be able to find kind of what works for you. And one of the best benefits of the marketplace is that you can also qualify for financial assistance. And it really depends on your household size and your income. And so in terms of who can shop on the marketplace, they just need to live in Oregon. You can't be incarcerated, so you can't be currently in prison or jail. And then there are some immigration requirements, but they are very broad. So a lot of people can qualify even with their immigration status. Anyone that has if they're a U.S. citizen or have an eligible immigration status, they can shop. And what that means is anyone who has a lawful presence status, except for those with DACA, can shop. So if you have any document that says you are allowed to be in the United States right now, you can qualify for a plan on the marketplace. So I do want to note there are many people that may qualify for COWM, which is the emergency medical through OHP, that can still buy full coverage through the marketplace. And so with all of the plans on the marketplace, they cover an average of at least 60% of the cost of services in these major categories. So it's a lot, and each plan will decide how they cover them differently. So maybe like individual services may be different and the cost will be different, but they do have to cover a large majority of the services. And that includes ambulance, emergency services, and hospitalization, maternity and newborn care, mental health services, and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices. So if someone has an injury or something happens and they need rehabilitative services like physical therapy, laboratory services. So if you need to get tests done by in a laboratory, like to get your blood drawn, and then as well preventive and wellness services. And I want to note too that a large majority, anything that's considered preventive services, so those are the things that they're trying to do to make sure that you stay healthy. A lot of those are at no cost with plans through the marketplace. And plans do have to cover, and they also cover pediatric services, including oral and vision care. So for children, oral and vision care are included in all marketplace plans. Though for adults, some plans may offer some vision care benefit, but they are not required to. And you can purchase a dental plan on the marketplace as well, separately, to get dental coverage. And I do just want to note too that with all marketplace plans, testing for COVID-19 is at no cost. So if you need a COVID-19 test and you have a marketplace plan, you would get that for free. And as well with the marketplace, they have all telehealth appointments. So things that can be done over the phone, through video chat or online, those all appointments are covered either for free or at least at the same cost or lower than what it would be if you were doing that same service in person. So that's really important right now when there are a lot of services we can get without having to go into a clinic and reducing our risk of exposure to COVID-19. And so I mentioned that the marketplace has financial assistance available. And this is really the only way that people can get help paying for private health plans. And there are two different kinds of financial assistance. And I will show kind of some example income limits in just a moment here so you can see, to get an idea if maybe you might qualify. But so the two different types, the first is the premium tax credit. And so that can help you pay for your premium. And that's the monthly cost that you pay to keep your insurance active. And then the second type of financial assistance are called cost sharing reductions. And those lower the costs that you pay for medical services if you select a certain type of plan. And so, for example, if you qualify for the cost sharing reductions and you select one of the plans that has those built in, you'll automatically have lower costs when you're getting medical services, like going to the doctor or picking up your prescriptions at the pharmacy. So those are the two kinds of ways that the marketplace can lower costs if you qualify. And to qualify for the financial assistance, you can't be eligible for other affordable coverage. So if you are offered, so if you are eligible for, let's say, the Oregon Health Plan and you with the full benefits, you're not going to qualify for the marketplace. But also that's okay because you would qualify for OHP, which would be great. So, but also maybe if you are offered insurance through your work, I still highly encourage you to apply to see if you may qualify, but it may depend based on how much that coverage costs you to enroll through work, whether or not you would qualify for the financial assistance on the marketplace. And so here are just these are the income limits. These are for 2021. And so if someone, the left hand kind of the half of this table here shows the income limit for someone to get both types of assistance with the monthly premium and the out-of-pocket costs. And so, for example, a family of 4 can earn up to $65,000 a year and still qualify for both types of the financial assistance. And then if someone's income is a little bit higher than that, but they still fall underneath these income limits shown on the right-hand side, they can still get help with the premium tax credit so they can lower their monthly premium. And so those income limits, I particularly show them not because not in a way that, if you think your income might be too high that you don't apply. I really put these on because I think a lot of times people think that their income might be too high. And when they see those limits, they're surprised and it encourages them to apply. So I think regardless, the best thing to do, like Ruby said with OHP, best thing to always do is to apply to see if you do qualify. So one of the really important things about the marketplace to know is that there are only certain times of the year where you can enroll in coverage. So with the marketplace, the one time that most people are getting coverage is during the open enrollment period. And we are in that period right now. So that goes from November 1st to December 15th. And so if you apply during that time, you can get coverage that starts on January 1st for the next year. And so that plan would be for the full calendar year from January to December. Outside of open enrollment, you can only get a plan through the marketplace if you have something that's called a special enrollment period. And so that is when you have a certain life event that makes you eligible to enroll, but you only have a 60-day period. So the most common one is if you lose health insurance. So if you lose coverage through no fault of your own, so, for example, you lost your job and your insurance left with it, you would have 60 days from when that insurance ended to still be able to enroll in a plan through the marketplace. This year, because of some of the changes with COVID-19, there also have been certain extensions. So if you don't currently have coverage and you lost your health insurance at some point since January 1st of this year, even if you're outside of that 60-day window, you may still be able to get coverage for this year. I know it would at this point, it would only be for December, but still, if you are needing coverage for December and you lost your insurance earlier this year, I encourage you to reach out soon so that way you can see if you maybe also qualify for coverage for December of this year, as well as your coverage for 2021. So in terms of how to enroll, I highly recommend for everyone that they do this with free personal assistance. I will show you in a little bit our website where you can get help. Ruby mentioned this also. I'll show you what that looks like briefly and how to get there, but that's on our website at oregonhealthcare.gov. And it's a quick tool. You just plug in your zip code and what kind of help you're looking for. If you're not sure, I encourage you to reach out first, and you haven't applied for anything first. I would encourage you to look for OHP help first and start there. Outside of that, if you want to do it on your own without any help, you can also do it yourself online at healthcare.gov. So that is the website where you would do the enrollment for the marketplace. You can also do this all over the phone with the healthcare.gov call center, and they can walk you through the entire application. It will be for free as well, and they have interpreters available in any language, so they can also walk you through that language in whatever, walk you through the application in whatever language you need.
Benjamin, I have a couple of questions.
Sure.
One question is, can someone have emergency OHP and also market insurance?
Yes, they can. And we encourage that you can absolutely have both. And then that's great because you would have your marketplace coverage to be able to access medical services that are not covered under the emergency umbrella with the COWAM, the emergency medical. But then you also have extra emergency coverage through COWAM if you do need that secondary. So yes, you can have both.
And the marketplace website is what? Is that the one with?
So the
Go ahead.
Yeah, so the marketplace, if you want to apply, the website you use is healthcare.gov. If you want to learn more information or find local help, you'll want to go to the Oregon healthcare.gov website because that's our state agency, and it will have more information that is specific to Oregon.
Thank you, Benjamin.
Yeah. All right. And so here are some helpful tools I want to encourage you to look at. So the first is the Find Local Help tool. And I'm just going to pull this up. This is our home website at oregonhealthcare.gov. And so if you're on our main website, you can find local help by clicking at this top bar up here that says Find Local Help. You can also find it down below where it says not sure where to start. Here you can find free local help. If you click that, this is just what that looks like. So like I mentioned, it's very short, the information that you need to put in. You can also put in a different language if you would like help in a different language, and it will connect you with, it will show agencies, either community partners or health insurance agents, depending on what you're looking for, that speak that language. Though I also want to say that all of them can also provide help via some type of interpretation services. Now, another tool that I would highly encourage you to check out is the window shopping tool. And so you can find that on our website on the main page as well with the window shop for 2021. And if you're using that tool, it essentially asks you for very brief information, your zip code, how old you are, and a few other questions to see what you might be eligible for, as well as your household income. And then you can preview, you can see all the plans available to you and how much the tool estimates you would pay for them for both the premium and your out-of-pocket costs. And one of the biggest questions that we get is, how much would this coverage cost me? Or how much would I pay for the doctor? And the answer is that it really depends. It depends on what plan you pick and what kind of financial assistance you're eligible for. So I highly recommend you use the window shopping tool to give you an estimate, because it is very quick, and then you can just have an idea before you apply. And I also want to say too, if you are applying, you have no obligation to choose a plan or actually enroll. So you have nothing to lose by checking out to see what you might be eligible for. So I just put up an example here to give you one example. This is someone that they're in Washington County. They're looking at 2021 plans. They have a household of 3 family members, and their yearly income is $30,000. But we're looking at coverage for just one person. Okay, so here's just the first plan that came up on the tool, and it helps you look at how much you would pay over the course of the whole year. So that can be a really good estimate, because even if you are, a lot of people, their first thought is, how much do I pay per month? But if they are using services often, they may want to pay a little bit more per month so that they can pay a lot less when they're using medical services. So for example, this person's income would get them the premium tax credit as well as the cost sharing reduction. So they would get help from the marketplace for their premium and for their medical services if they pick a silver plan. So if they were able to maybe pay a little bit more per month, if they were able to pay $87 per month, they would have really low copays when they're using their services, like $5 to see a primary care in person, $10 to see a specialist, or $5 for generic drugs. So if there's maybe someone that doesn't use their coverage very much or at all, but they really just want it as just in case, maybe they want to go for a bronze plan, which would be lower payment per month, only $1 per month. And then they would pay more if they do need to use those services, but they have that safety net that's there for them instead of having no coverage. So I do want to emphasize again, this is just one example. So I recommend that you use the tool and you can see what you might qualify for on your own.
Benjamin,
you can also.
Can you go back to the previous? So can you elaborate more about the deductible? The $100 versus the $85.50, please.
Sure. So the deductible is one of the more complicated parts of health insurance. The idea is that for certain services, your health insurance is not going to help you pay for them until you've paid a certain amount into the plan in the year. Now, this is particularly for services like laboratory or X-rays, for example, where you might have to pay the full cost of however much that is until you reach your deductible in the year. Now, once you've met your deductible, then your insurance will start to kick in and pay more for those services. There are some services that the deductible does not apply, and that's typically things that do have a copay. So for example, even with this bronze plan that's on the screen here, it does have a high deductible, but for the primary care visit, even if you haven't paid up to your full deductible yet, that primary care visit is always going to be $50. However, if you wanted to get, for example, a blood test done, which would be laboratory services, and if that plan covered it at 20%, the plan, you would pay full price until you met your deductible. And then if you do meet your deductible, then you would be paying only 20% of the cost. So in a lot of times with plans that have a lower deductible, you would be paying less on your own for services until the insurance starts to kick in. But again, it does change depending on which services you're looking at.
Thank you, Benjamin.
Yeah. And I really want to encourage, I'm definitely happy to answer whatever questions we have. I also encourage you, if you have any problems, I know I showed you all some tools that you can use online. If you can't access them or you're having any issues, feel free to call us. Our number is here on the screen, or send us an email, and we can help do that over the phone for you. So if you need help finding someone in person for assistance, you can call us. We can use the tools for you and give you a couple of phone numbers or connect you to a couple of organizations. Or we can even help you use the window shopping tool, give you just a brief idea of what you might qualify for, and again, probably connect you with someone that can help you with the actual enrollment piece. Thank
you, Benjamin. I have a comment in here from one of the participants, and I hope that people don't take it personally here. The comment is that, you know, it is totally frustrating when you go to the OregonHealthcare.gov, and the comment continues, when I applied, I was rejected due to my income. After that, no response, even if I call. I do not know if these guys are responsible now. I am looking for insurance coverage. And he can see this this note, whoever is Mahish, Benjamin can see this note as well. So I will let him also maybe respond to that, or as you can tell, there is thousands and thousands and thousands of people who are applying and calling and, you know, all these kind of things. So I hope people don't take it personal that they're not getting back to you, but also in the meantime, I hope there is a ticketing system or an intake system that anybody in the marketplace or the Oregon Health Authority or Virginia Garcia or whomever to call people, even a day, 2, 5 days later, or at least to get a call back from any of the phone numbers that we are putting online in here.
Yeah, and I'm sorry to hear that was your experience. I also recommend, that's another reason that I do recommend getting help from community partners in person, or personal assistance, maybe not in person, because they do also have, I know that sometimes it is really hard to reach different agencies by phone, especially because they do have so many more people applying than ever. But people are often, community partners may have other ways of seeing what's going on with your application. Maybe if something wasn't entered in, the correct way that the application determined it in a certain way, and they may be able to reach the Oregon Health Authority and the ones that are really determining those applications in ways that are easier. So if you haven't already, I recommend that you do get help from someone in person that might be able to help things go a little faster or give you some extra clarification.
So as Benjamin said, when we are dealing with, instead of the entire system and that you might be bogged down by the number of people who call, if you're calling Virginia Garcia or the other organizations, they might not have as much pressure as, the other, the bigger health system. So maybe your answers are, responded to faster, and or maybe you can go and in-person visit, with them to get the help. So anything else, Ignolia, Ruby, Anna, or Benjamin, you want to say about that?
Yeah, so I just want to just to clarify very well that Virginia Garcia, we help with the Oregon Health Plan. We don't help with the marketplace. If we have clients coming to Virginia Garcia, by any reason, we have patients calling and they want to make an appointment with our sisters. If a patient, they don't qualify for OHP, this person will be referred with someone who works under the marketplace. So there is a list of agents that we refer them, that they are trust, and they're gonna take their case seriously, and they're gonna work directly with the marketplace and help people to get their coverage.
So Mahish has, and I'm sorry if I'm butchering your name. So she is, or he's, looking for coverage, and she put her phone number for us to look at. She's willing to pay, and but she needs to have some kind of response, some kind of action to that. And I'm sure you are in good hands. Everybody has your phone number now, and hopefully they will contact you to get something getting started. I just want to if people don't have any more questions, I'm just gonna say that please do contact, whether Virginia Garcia or the health plans or any of the other assessors in different cultural organizations. The worst that can happen, somebody is going to tell you, no, you do not qualify. But do not say, well, I make this much money, I do not qualify. Let the experts tell you that you qualify or don't qualify. Do not leave it up to yourself to say, if I get sick, I'm just going to go to the emergency room and that's it. These are people that they're there to help you out, and whether you make $1 or whether make, as you saw from the Benjamin's presentation, depending on your family size, up to $100,000, $120,000 a year. So please do not say, oh, I make too much money. If you qualify, you qualify, and you will be covered. Do not wait until the last minute to look for coverage. If you guys do not have any questions, if the attendees don't have any questions, I would like to thank Benjamin, Agnolia, Ruby, and Anna for their patience and their presentation, and to all what they do, because really, what they do is tremendous, and especially these days, with the open enrollment. So I'm sure there are thousands of people who are calling and who are dialing and who are emailing and texting and messaging and all these kind of things. So we truly appreciate your patience and all what you do. And I want to thank you also for your partnership with the Muslim Educational Trust. And, we have a saying in Arabic that says, one hand cannot clap. You need to have two hands to clap. So, we need to have everybody's partnership, everybody's work together to help others and to help ourselves as well. So thank you very much for all your help. Thank you for all the panelists. Thank you for all the participants who joined us today on Friday and Sunday afternoon. We will send responses to the questions that we had. We will send the survey if you have, if you can, it's going to be a short survey. If you want more information or anything, we will be able to help you out, and we'll be able to cover what we have. Thank you. Have a wonderful evening, and see you next time.
Thank you.
Thank you. Have a good evening.
Thank you so much.
Bye.
Bye.